and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
Well, in our opinion, of
Aren't you
course,
happy about that, Brad?
Strong like bull today.
Okay, today we're going to talk about, you haven't said that in a while.
I know, I felt like it though.
Today we're going to talk about the absolute best self-treatment for SI, sacroiliac joint pain. And
That's a mouthful.
I think we need to talk about a little bit what it is.
Exactly,
So-
because it's a little scary otherwise.
Right, let's come on up here, Brad. Lonnie, are we okay?
Well, we're okay. Are you
All right.
okay? Am I okay? Okay. Right
All
here.
right, so we have here, Brad, if you want to put yourself in the position that this is right now.
Okay, so we're looking at the back side.
Just like this.
Yep.
So if you go down here and where your pelvis is, you have the two bones on each side, which are called the innominate bones or ilium. And in the middle here is a triangle-shaped bone, is the sacrum.
All right. These are actually the nerves. Let's get those out of the way because I think that's a little misleading.
So now you can see the triangle-shaped bone. And in between the ilium and the sacrum is this SI joint, the sacroiliac joint.
Right. And it's a rough joint. It's not smooth like a knee or like
No.
a shoulder. It's rough. There's cartilage in there, but there's a lot of connective tissue,
Yeah, a
ligaments.
lot of ligaments holding it together.
Right, and it's supposed to be a stable joint.
Right. One of the things is it's a weight-bearing joint. All the weight of the spine is going through those joints.
Right.
So it takes a lot of weight.
Right, and when you're walking or running, each side takes a lot of forces, and we need to keep that stable. And there can be one source of pain when you have some irritation there.
Right, and I think that's quite often what you'll see is when you're increased pain with like going upstairs or uneven surfaces and such like
Right,
that.
and sometimes just with walking can get you flared up if it is
Right.
irritated.
So one of the problems, also Brad, I should have shown when I was up there, is that a lot of times one of these bones, these iliums, gets rotated.
Oh yeah.
And most often it gets rotated back this way.
Yeah, we'll exaggerate that a little bit, Bob, if we just loosen that up a little bit. And you
There you go, yeah.
see some movement there.
And that's not good.
No.
If it gets rotated and stuck back there,
Yeah.
it's going to give you pain. And so as a manual therapist, a lot of times we're rotating it back. And that's beyond what you can do. I mean, you can't do that yourself, but we'll show you some things to try to help coax it back.
Right. Yep. There's
So-
some nice little stretches and some exercises that we teach patients easily to go home and do.
The other thing is, as we get further along, if this is a little unstable here and it's not holding it like it should, the ligaments, we might have you use a belt to help hold it together better.
Would be called an SI
Right,
belt.
SI belt,
SI belt.
right. And that's what the muscle strengthening we're going to show too,
Right.
Brad, is to help strengthen the muscles around the pelvis to help hold that SI in place. So it all kind of comes together here, Brad.
And that's why I'm carrying this green ball around, if you wanted to know. Now,
I'm sure
Bob,
people did.
another thing of importance is there's a lot of people out there, thousands that have not seen us before.
Please come to us and subscribe. We have a subscribe button over here on the left, or if you're on your phone, it might be down here somewhere. Take a look, you'll find it. We provide videos on stay healthy, fit, pain-free, and we upload every day.
SI job, SI joint.
SI, what? He totally lost me there. I don't know what he's trying to
We're
say.
going on to the SI now.
All right, one of the things is when you have SI problems, quite often you're going to have a leg length discrepancy, which means is one of your legs is longer than the other, which throws your pelvis off.
And it may not be longer, but because the SI is shifted, it may appear longer or
Oh,
cause-
sometimes you're right. If the ilium is rotated, it makes it look higher on one
Right,
side.
sure.
But either way, one thing you might try, so if I take Napoleon bone apart here, if you guys haven't heard the joke, and if I just put my hands here and stick my fingers in the pelvis right here on myself, and I see one that is higher, so I'm standing here and I go like this, and it's hard to see on me, but you'd have to have someone look at it, and if one is higher, that leg might be higher, and therefore you may want to try correcting and see.
Why don't you turn around, Bob? Because I think the best way to do this, and you probably do it, is from behind the person. I'm going to get down out of the way. And right there, I can clearly feel his bones. And right there, now, actually, the viewers are in a good angle to see. And I want you to shift a little bit, Bob, done on purpose. Shorten one. There you go. So you can see there now, correct it. Go down. There you go. So that was exaggerated. But it's possible you could have that much. That's kind of like dancing, Bob.
Or let's say it's been determined by someone that, a professional, that you do have a leg length discrepancy.
Sure.
Then, based upon asking that professional, you might want to correct it. And all you want to do is, you can slide a heel wedge in your shoe. I've had people just take a piece of carpet and cut it out in the shape of a heel, Brad,
Yep.
and put it in there and try it.
Right.
You know,
It's just a temporary thing. If it makes it feel better, it's like, oh yeah, that does feel better. Then you can go to the store and buy an actual heel lift.
right. And usually what we do is we'll first, I'll put something down and then correct it, and then see if it does level it out, and you can even see how it feels when they put
Right.
it down on the floor.
Sure.
Here. Now, they generally do not correct the entire discrepancy, Brad. Generally,
Right.
it's half.
Sure.
So, like if it's a 1/4 inch, the heel should only be the heel wedge should only be an 1/8 inch.
Right. And this is one of those things that, the people at home never done it before. This is hard to do when you're an
Right.
experienced professional. So we're telling you what to do. You can play with it a little bit, but it takes some practice usually.
Okay, again, this is going to be based upon averages, and the average person, quite often, if they're having SI pain, it means that generally on that side, that ilium is rotated back.
Okay.
More often than not.
Right.
So this is the first thing I want you to try. Let's say the pain is on this side. I'm going to have you lay down, and we're going to try to rotate it back forward again. So what you're going to do is you're going to put this leg off the edge of the bed. Don't fall off. I don't want anybody letting us know that they fell off. And you're going to let it hang like here, and you're going to bring this one up. And if you even didn't have anybody with you, Brad, you could
Right.
just do a little bit of this, rocking
Yep,
here,
yep.
and see if it'll kind of, again, rotate that ilium back in place.
And you're going to know if it's the right thing to do, because when you do this, it's clearly going to feel better. It's like,
Right.
oh, wow, that
Yeah.
does make the pain go from a 6 down to a 3.
If it's worse, then you might want to do it on the other side
right,
and see what
switch
happens.
it around. Yeah, if it makes it worse, you stop. If it
Yeah.
clearly makes it better, you know you're on the right track.
Good point, Brad. We're always looking for things to get better. We're not
Right.
no pain, no gain. This should not hurt.
Right.
I suppose you could have someone give a little resistance.
Right. I mean, if I'm working on a patient and they do this and say, boy, that feels better, I may do this and add slight pressure,
and then they can even push up.
a little muscle energy.
Yeah, they're pushing up with this one, pushing down with that one at the
Yeah,
same time.
Exactly.
So, and if it didn't work, maybe try the other way.
Right.
Try going this way and doing the same type of thing.
But again, you get some people, they think that it has to hurt to get better, but in this case, it's further from the truth. It has to go the other way. When it feels better, you know you're on the right track.
Now, one of the patients I just had, we did a bracing on her. So again, what I did as a test on her first is I actually just pushed her pelvis together like this, and I had her walk because she normally had pain with walking. And I know this looks stupid, but actually this is the way to do it. And it actually felt better right away on her. She just said, oh, that feels better. So we got her a belt. And
What kind of belt, Bob?
an SI belt. What would you think would be called? So, it's just a belt, a very thin belt that straps around you. And
Here, let's show them where it goes anatomically.
yeah, that's
on
a good
Leopold.
idea. So it's going right around like that. So you can see how it's just going to squeeze these bones together
Right.
and keep them in place.
One thing, if it's up here above the ilium or the pelvis, it's going to go into the stomach area, and that's not going to do any good, but make you feel uncomfortable. So it's got to go
Right.
down below that.
And you got to be able to cinch it up.
Right.
I mean, that's key. Otherwise, it's not going to help you out.
An elastic belt is probably not going to be enough.
Right. All right, let's go into a couple of exercises, Brad, that you can do to try to help stabilize. So we're trying to strengthen
Should we
the
show how
muscles.
that belt goes on?
Well, if you want,
Well,
sure.
you go talk, Bob, and I'll put it on while you're talking.
So one of the exercises you're going to do, you're just going to lay flat on your back. You're going to go ahead and arch your back a little bit, tighten up your stomach, and then you're going to, can you throw me the ball, Brad?
Oh, you bet, Bob. There'd be nothing more I'd want to do than throw you the ball. Catch.
So you're going to put the ball between your legs, and you're going to feel this. This goes down, the muscles that attach all the way into the pelvis. So again, I've arched my back, I've tightened my stomach, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you can do a good set of 20 of these, Brad.
Sure.
You can really work these.
Right, so you're working the adductor muscles?
Right, and adductor muscles attach all the way into the pelvis.
Right.
Trying to help stabilize a little bit. And then you're going to go the other direction too, Brad. You can actually take a belt.
Here, I'll help you, Bob. I'm clear now.
And you're going to tie it around your leg. You could use a sheet too, I guess, but
Could you
anything.
use TheraBand like this?
You could use TheraBand.
So
You could
got
do
something stretchy?
Sure. This
So
is
this
more
would be like an isometric?
more isometric. So same thing. I'm going to arch my back a little bit, tighten up my stomach. Make sure you're breathing during these.
Sure. Yeah, you hold your breath, your face turns
Same
red.
thing. Counting to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9,
Arch
10.
right here, huh,
Yeah,
Bob?
a little bit of arch. And again, you can repeat, you can do 10, 20 of these too.
Right. So the idea is we're strengthening all these muscles.
So external rotators that are going to, they go all the way into the buttock, you know, and they help,
They're going to help stabilize
the
that.
pelvis.
Right.
Yeah.
Yep.
You know, as another one you could do clamshells too, which is, I don't want to worry about my mic here a little bit, but you lay on your side like this and you're just going to work on doing clamshells.
Right.
That
And
helps
this is
strengthen
one,
the
if you had the
muscles.
TheraBand in there, you could leave
Yeah.
it on and use it from resistance.
So you're showing the belt, Brad?
Yep, so we talked about the belt, get it low enough below the pelvis. And this one is designed like this. You just pull, and I'm going to cinch it up like this. And I'm going to get tight, tight, tight. And there we go. And now when I walk,
It should feel better.
it should feel better. That would be an indication you're going to wear it.
All right, the other thing is to change some of your habits. Make sure you're not standing on one leg like this.
Yeah.
You know, that's throwing off those ligaments, stretching
Sure.
them out. Don't sit on uneven surfaces like one, you know, on the butt on one side or a couch. Do not sit on your leg.
Some
like
people
this.
can select this a long
Yeah,
time.
and that's with men. Don't sit on your wallet for, you know, especially if you have a big thick one for a long
Bob's
period of
got a
time.
really big, thick wallet.
That's because I never take anything out of it. The dust comes out when I open it. And the last one is, you know, like I imagine mostly it's women shaving their legs. They cross their legs and they lean way down, or they're like this. That could throw the pelvis
Sure,
off too.
sure.
So you got to hire someone to shave your legs, I guess.
Oh, exactly. And you put your shoes on.
Right.
That's a shorter one, though.
Again, the whole thing is don't do these in a prolonged period of time. So.
Exactly. Go on in repetitive motion,
Remember, folks, we can fix just about anything.
except for that broken heart.
Well, we're working on it. Thanks for watching.
Say no more, Bob.